Red blood cells RBCs, also known as erythrocytes, have the primary function of transporting oxygen from the lungs to the tissues and organs of the body, and then carrying carbon dioxide back to the lungs to be exhaled. What is anemia? Anemia and without anemia blood is a decrease in the RBC count, hemoglobin, and/or hematocrit values, resulting in a lower ability for the blood to carry oxygen to body tissues. Cause of anemia: increased requirements, menstruating females, pregnancy, lactation, growing infants and children, erythropoietin treatment, increased loss, GI bleeding, menorrhagia, persistent hematuria, intravascular hemolytic anemias, regular blood donors, parasitic infections, decreased intake, vegetarian diet, socioeconomic factors, decreased absorption, upper GI pathology, egg, celiac and Crohn's disease, gastrectomy, ications antacids, Zantac. Symptoms of anemia: fatigue and shortness of breath occur because the body is trying to compensate for the lack of oxygen by working harder, which tires you out quickly. Chest pain and heart palpitations result from the heart pumping harder to circulate more oxygenated blood. Dizziness and headaches can be due to the brain not receiving enough oxygen. Pallor happens because fewer red blood cells give the skin a pallor appearance. Pulsatile tinnitus, a whooshing sound in the ears, can occur due to changes in blood flow. Frequent infections may occur if anemia is related to a condition affecting the immune system or bone marrow, such as in some chronic diseases or bone marrow disorders. Normal values. Category values. Reference: men 13 grams dl, women 12 grams dl, pregnant women 11 grams dl, infants from 2 to 6 months 9.5 grams dl, children from 6 months to 24 months 10.5 grams dl, 2 years to 11 years 11.5 grams dl, children from 12 years 12 grams dl. Investigations of anemia. The red cell population is defined by 1. Quantitative parameters: volume of Pak cells, that is the hematocrit, hemoglobin concentration, red cell concentration per unit volume. 2. Qualitative parameters: mean corpuscular volume, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration, mean corpuscular volume. It is the average volume, RBC. Fel, normal 80 to 98 or 80 to 98 Fel. Mean corpuscular hemoglobin. It is the average hemoglobin content per RBC. Normal value is 27 to 31 Pel. Mean corpuscular hemoglobin concentration is the average concentration of hemoglobin in a given red cell volume. GMs DL. Normal 32 minus 36 G or D. Management. Care objectives: determine the cause of iron deficiency. The etiology is often multifactorial, even when there is an obvious cause. Investigation of serious underlying causes, e.g., cancer in adults, is recommended. Aim of treatment: normalize hemoglobin levels and red cell indices. Replenish iron stores. Individualized disease-specific management depending on underlying cause. Lifestyle management: it is recommended that patients with iron deficiency receive dietary advice. Non-pharmacological management: tea and coffee inhibit iron absorption when consumed with a meal or shortly after a meal. Vitamin C ascorbic acid is also a powerful enhancer of iron absorption from non-meat foods when consumed with a meal. The size of the vitamin C effect on iron absorption increases with the quantity of vitamin C in the meal. Germination and fermentation of cereals and legumes improve the bioavailability of iron by reducing the content of phytate, a substance in food that inhibits iron absorption. Promote and support exclusive breastfeeding for about 6 months, followed by breastfeeding with appropriate complementary foods, including iron-rich, through the second year of life.